Most people think heart attacks always give a warning. Chest pain, numbness in the left arm, a sudden stroke. That is what the movies usually show. That is what most people expect. But after 60, the most dangerous cardiovascular events are often silent. They are the ones that develop gradually while you sleep. No warning, no time to call for help, no second chance. And here is what shocks most people when they find out. Those events almost always stem from something completely ordinary, something totally unremarkable, something you did right before turning off the lights. In this video, we are going to look at how we are unknowingly hurting ourselves every night with our habits. Then, we will show you how to fix it step by step, simply, every evening. Pay close attention. What you learn in the next few minutes might be the most important thing you hear all year. Here is what most people do not know. Your cardiovascular system does not rest when you sleep. It simply shifts its mode of operation. In a healthy body, blood pressure naturally drops at night, usually by about 10 to 20% compared to the daytime. The heart rate slows down and the arteries widen. It is a biological reset, a form of maintenance your body has performed your whole life. But after 60, that system becomes less reliable. Blood vessels stiffen. Blood pressure regulation becomes less precise. Some of the hormonal signals that once protected your heart at night begin to weaken, and the margin of error becomes much smaller. Think of it this way. During the day, your cardiovascular system has backup mechanisms. It can compensate. It can adapt. At night, many of those protective mechanisms are essentially disabled. Your body runs on a skeleton crew. That is why the night is different after 60. That is why the period between midnight and 6 a.m. carries the highest risk of heart attacks and strokes for older adults. Not the afternoon, not the morning rush hour, but those quiet hours. Those hours when nobody is watching except your habits. And here is the most important part. What happens during those dangerous hours is largely determined by what you did before going to bed. The meal you ate, the medication you took or did not take, and the temperature of your bedroom, decisions that seem completely routine. That is exactly what we are going to talk about, starting right now with the habit that will surprise you the most. I want to ask you something. What time did you have dinner last night? And what was on your plate? Surprisingly, many people over 60 often report eating dinner around 8 or 9 p.m., sometimes even 10. A heavy meal, pasta, rice, meat, maybe some fried food, followed by sitting on the couch and going to bed within an hour or two. I understand why that happens. Busy days, family schedules, habits built over a lifetime. But from a cardiovascular perspective, this habit is silently damaging your heart. A heavy, late-night meal is one of the most underestimated stressors your heart can endure. Here is what is happening inside your body. When you eat a large meal, your digestive system demands a significant increase in blood flow. Your heart has to pump harder. Your blood pressure rises. Triglycerides, the fats circulating in your blood, spike within 2 to 4 hours after eating. Now combine that with going to bed. Your body expects the night to be a time of relaxation, not a cardiovascular emergency. Instead, your heart has to work overtime to digest a heavy dinner while trying to shift into nighttime recovery mode. Those two demands directly clash. And for someone over 60, even with just moderate hardening of the arteries, this conflict can have serious consequences. Studies have consistently shown that eating within 2 to 3 hours before bedtime is linked to elevated nighttime blood pressure, higher rates of acid reflux that can mimic or even trigger cardiac symptoms, and an increased risk of cardiovascular events while you sleep. The solution is not complicated. Eat your main meal before 6 or 7 p.m. whenever possible. If you need to eat later, keep it light, focusing on lean protein and vegetables instead of high-fat foods. Does your dinner schedule sound like what I just described? You might be surprised by how many people answer yes, without ever realizing how it could affect their heart health. Now, pay close attention to this next point, because this is where some of the most preventable damage occurs. According to clinical studies, if you are over 60 and taking medication for high blood pressure, and statistically, over 60% of people in this group do, the timing of your medication is incredibly important, much more so than most doctors take the time to explain. For most people, blood pressure follows a predictable daily rhythm. It rises in the morning, peaks in the afternoon, and drops at night. But a significant number of people over 60, especially those with hypertension, never experience that normal nighttime drop. Their blood pressure stays elevated, or even spikes in the early morning hours. This condition is called nocturnal hypertension. Most people have never heard of it, yet it is far more dangerous than typical daytime high blood pressure. While you sleep, your arterial walls are not prepared to withstand sudden surges of pressure. A blood pressure spike at 3 a.m. affects your arteries very differently than a spike at 3 p.m. It increases the risk of rupturing vulnerable plaques inside your coronary arteries. It increases the risk of blood clots forming. It increases the risk of landing on the operating table. If you only take your blood pressure medication in the morning, it may wear off when your body needs it most. If you forget your medication entirely, you leave yourself completely unprotected during your most vulnerable hours at night. So, what should you do? Speak specifically with your doctor about the timing of your medication. Ask if you should take your blood pressure medicine in the evening instead of the morning. That conversation takes only 2 minutes. It could save your life. There is strong scientific evidence, including findings from the Hygia chronotherapy trial, showing that taking blood pressure medication at bedtime can significantly lower cardiovascular risk while you sleep. That is not a minor adjustment. It is a conversation that could save your life. Never assume that timing does not matter. In cardiology, timing can make all the difference. Yet, most people over 60 have never discussed this with their doctor. Now, I want you to think of someone you know who snores. Maybe it is your spouse, maybe it is your parents, or maybe it is you. That loud, uneven noise at night. Most people treat it as an annoyance, a laughing matter, but I see it as a warning sign of heart disease until proven otherwise. Having reviewed the scientific research, I mean that literally. Sleep apnea is one of the most underdiagnosed and underestimated conditions I see in patients over 60. It is estimated that more than 30% of older adults have some form of sleep apnea. Yet, the vast majority of them have never been diagnosed or treated. They are completely unaware of how it is affecting their heart every single night. Here is what actually happens during an episode of sleep apnea. You stop breathing for 10 seconds, 40 seconds, sometimes even longer. This can happen dozens of times every hour. Each time, your blood oxygen levels plummet. Your brain senses an emergency and immediately triggers a stress response. Adrenaline is released, cortisol spikes, your heart rate suddenly quickens, and your blood pressure surges. Essentially, your heart is forced awake while the rest of your body is still asleep. Night after night, year after year. Now, imagine that happening 30, 40, or even 50 times a night. The toll it takes on your cardiovascular system is massive. Sleep apnea is directly linked to a 3-fold increase in the risk of a heart attack. That statistic alone should make you pause. It is also closely linked to irregular heart rhythms, including atrial fibrillation, a condition that dramatically increases stroke risk. It accelerates the thickening and stiffening of your arterial walls. And because all of this happens while you are asleep, most people have absolutely no idea anything is wrong until a major cardiac event strikes. The warning signs are not always obvious. Yes, loud snoring is one of them, but there are others. Pay attention to symptoms like waking up with a morning headache, feeling exhausted despite getting enough sleep, frequent nighttime urination, waking up with a dry mouth, or waking up gasping or choking for air. Okay, if any of those symptoms sound familiar, talk to your doctor about getting a sleep study. If you snore loudly, are over 60, and have a history of heart disease or stroke, getting evaluated for sleep apnea is a must. It is an essential part of your cardiovascular care, period. The treatment, which is often a CPAP machine, is not glamorous. I know that. But the scientific evidence of its benefits for heart health is truly remarkable. Patients who use CPAP therapy consistently see a noticeable drop in blood pressure, lower rates of atrial fibrillation, and a significantly reduced cardiovascular risk. One device, one habit, massive protection. Does anyone in your family snore? Has anyone ever told you that you stop breathing in your sleep? Think twice before you dismiss this method. Now let's talk about another habit that comes from completely logical thinking, and because of that, it is very easy for us to overlook. Many people over 60 deliberately cut back on alcoholic drinks in the evening. The reason is easy to understand. They want to avoid waking up at 2 in the morning to use the bathroom. Interrupted sleep is incredibly frustrating. Waking up in the middle of the night increases the risk of falls. So they stop drinking water after dinner, sometimes even after 4 in the afternoon. I completely understand that reasoning, but from a cardiovascular standpoint, going to bed even slightly dehydrated is also a significant risk factor, and that is something almost no one ever mentions. When you are dehydrated, your blood becomes thicker. It gets thicker and does not flow easily through your blood vessels. For the cardiovascular system of a young person, that is usually just a minor, tolerable inconvenience. But for someone over 60, whose arteries are already stiffened with plaque buildup, it is a completely different story. Thicker blood flows more slowly through already narrowed arteries. It is also much easier for dangerous blood clots to form. And here is the timing issue that most people never consider. While you sleep, your heart rate naturally slows down. Your circulation slows down too. Now, combine that slower circulation with thicker blood in a body that lies motionless for 7 or 8 hours, flowing through arteries that might already be partially blocked. The combination of dehydration, a slow heart rate, lack of movement, and underlying arterial disease is one of the reasons why heart attacks and strokes so often happen in the early morning. Fortunately, the solution is incredibly simple. Drink a full glass of water before going to bed. You do not need a lot, just about 8 ounces. That is all you need. This amount of water is enough to help keep your blood from getting thicker than it should while you sleep. Keep another glass of water on your nightstand to drink when you wake up. If you wake up feeling a bit thirsty at 2 in the morning, your body is asking for something that your heart desperately needs too. You do not have to choose between a good night's sleep and protecting your heart health. Now, let me share another habit that surprises most people when I bring it up because it sounds almost too simple to make a difference. What is your bedroom temperature at night? Most people have never considered that question from a heart health perspective. They only think about comfort. They usually think about personal preference. But in reality, your cardiovascular system works best within a certain temperature range. Outside of that range, your heart has to work much harder than it needs to. Let's start with a bedroom that is too hot. When the temperature rises above about 72 degrees Fahrenheit, your body has to work constantly through the night to dump that excess heat. Your blood vessels dilate, your heart rate stays elevated, you sweat more, which increases fluid loss. And that brings us right back to the dehydration issue we just discussed. Perhaps even more importantly, your sleep quality suffers. You spend less time in the deep restorative stages of sleep. These are the stages when your heart does its most critical recovery and repair work of the night. Now let's look at the opposite. A bedroom that is truly too cold, below about 16 to 17 degrees Celsius, creates a completely different kind of cardiovascular stress. Cold temperatures cause vasoconstriction. Your blood vessels constrict to keep your body warm. As they tighten, your blood pressure goes up. Your heart has to pump blood against greater resistance. For someone who already has coronary artery disease or high blood pressure, this nighttime blood pressure spike is not minor. The optimal bedroom temperature for both good sleep and heart protection is between 65 and 72 degrees Fahrenheit. Within that temperature range, your body stays in thermal balance. Your blood vessels remain relaxed, your heart rate is low and steady, and your sleep is deep and restorative. Just a simple temperature setting, yet it offers real protection. Everything I have described so far might sound like a long list of things to worry about, but I want you to look at it in a different way. When you put all 5 of these habits together, you get a practical blueprint to protect your heart every single night. I call it the heart-safe evening routine. It fits easily into your daily life without demanding major lifestyle changes. As recommended by medical experts, here is how you do it. Eat your main meal between 6 and 7 in the evening. Choose lean protein, vegetables, and a moderate amount of carbs if needed. No need to overeat, but do not skip dinner either. Just a balanced meal at a reasonable hour. That will give your heart 3 to 4 hours to finish digestion before you go to sleep. Around 7 in the evening, focus on your hydration and medication. For many people, taking blood pressure medication in the evening can offer significantly better protection. Please take this discussion seriously. Between 8 and 9 in the evening, begin your wind-down period. Take a gentle walk, read a book, or have a relaxing conversation. This is also the time to step away from screens, especially the bright screens of smartphones, because they suppress melatonin production and keep your nervous system alert longer than necessary before bed. By 9, prepare your bedroom. Adjust the temperature. Open a window for a few minutes if needed. Place a glass of water on your nightstand. These tasks take less than 90 seconds, but they are crucial. By 10, you should be in bed. And here is one final detail that is completely free. If you snore, or if someone has told you that you stop breathing in your sleep, try sleeping on your side instead of your back. Sleeping on your back can worsen airway obstruction. Simply changing your sleep position can significantly reduce sleep apnea episodes. So, the question is whether this method works. The scientific evidence clearly proves that it does. The real question is whether you will actually follow it. And that is a question only you can answer. Now, I have talked to families sitting in hospital waiting rooms at dawn. Families who had no idea anything was wrong when they wished their loved one good night just a few hours earlier. I have read autopsy reports from scientific studies of people who had just been planning their grandchild's birthday party a week prior. And in every single case, the factors that caused their deaths were not a mystery. It could be a late dinner, forgetting to take blood pressure medication, a bedroom that is too hot, silent dehydration, or an airway that had been blocked for so long that everyone just assumed the snoring was harmless. These are not rare or exotic risk factors. They are simply the background noise of millions of ordinary evenings. But that background noise, repeated night after night, year after year, can eventually turn into a heart attack that no one saw coming because no one knew where to look. Everything we have covered today is general medical information based on current cardiovascular research. It is not a substitute for personalized medical care. Before making any changes to your medication schedule, especially the timing of your blood pressure medication, please consult with your doctor. Goodbye, and see you again.